Okay, so hello everyone. Welcome to our webinar. And I'm Natalie. I'm the director of the Global Mental Health Outreach Program. And thank you all for joining our webinar, firstly. And we're very happy to be collaborating with Minds Foundation to bring you this webinar. So before we go into the actual presentation, I will briefly introduce both of our organization first. Okay. Um, The Global Mental Health Outreach Program is a nonprofit organization formed by a group of high schoolers from all around the world. And we organize a lot of activities like webinars and campaigns in hopes of removing the stigma surrounding mental illness and to educate the public about mental health. And the Minds Foundation is a mental health nonprofit that is committed to eliminating the stigma surrounding mental illness using grassroots approach through education, training, and providing access to cost-effective, high-quality care. Their vision is to create a world that fosters a shared approach to mental wellness in which anyone, anywhere, can access the resources they deserve. So due to some unforeseen circumstances, Pragya cannot be joining us today. However, we are very happy to have Ankita and Shreya to be our guest speakers today. Ankita is a research associate at the Minds Foundation and is currently pursuing a master's degree in clinical psychology. She's a certified youth mental health first aid provider as well as a child abuse primary respondent. Shreya has recently completed her master's in applied psychology and has experience in working with children and youths. She's currently interning in the Minds Foundation. So now we'll move on to a quick game before the actual presentation.
Hello everyone, my name is Cheryl and I'm the director of the Global Mental Health Outreach Program. So before we dive deeper into the different eating disorders, let's play a quick true or false game. So feel free to type your answers in the chat. So our first question is, a person with an eating disorder isn't trying hard enough to eat right. Next slide, please. Yes, first question. A person with an eating disorder isn't trying hard enough to eat right. So if you think this is true or false, please feel free to type your answers in the chat. Cool. So I think many of you think it is false. So this is actually the correct answer. And eating disorder is a real illness, and it is not about lacking the will to eat right. So on to our next question. The most common types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. True or false? Cool, so this is true. These disorders are marked by extremes in eating. And then next question. Females are more likely to get eating disorders than males. Yes, the answer is true. Girls are much more likely than boys to get anorexia. Next question. Older adults are more likely than teens to have an eating disorder. Yes, it's false. Teens and young adults are actually more likely to develop an eating disorder than children or older adults. Next question. People with anorexia nervosa see themselves as overweight even though they're dangerously thin. So I see some of you may have typed true, some of you say it's false. Actually, the answer is true. People with anorexia are obsessed with being thin, and they often develop like peculiar eating habits. All right, next question. People with bulimia nervosa are very thin. Wait, next slide. So it actually depends. Like for the question, we will learn more about this disorder later. And on to our next question. People with binge eating disorder often feel out of control during a binge eating episode. So the answer is true. Binge eating means eating a large amount of food within a certain period of time, and many binge eaters eat alone because they actually feel embarrassed at how much food they're eating. And on to our last question before the presentation. People with eating disorders often don't know they're ill or hide their condition from others. Do you think this is true or false? Yes, this is true. And because of this, they people may not get treatment. And like so family members or close friends who see the problem should definitely encourage the person to get help. Cool. So this is the end of our short game. And now we will hand it over to Ankita and Shreya, and they will talk more about the different types of eating disorders and like how to help one with this disorder. So hope you guys enjoy it.
Thank you, Cheryl, and thank you so much, Global Mental Health Outreach, for having us today. And hello, everyone. Thank you so much for joining in. I'm Ankita Gupta, and today I will be conducting the webinar on understanding eating disorders with my co-facilitator, Shreya Makhija. Shreya, please unmute yourself and say hi to everyone here.
Hi, Cheryl. Hi, Natalie. Hello, everyone. Thank you for hosting us. We look forward to this webinar.
Yes. Okay. So before we begin, I would just like to have a quick check in with everyone. If you could use the chat box to let us know how you're feeling today, maybe a word that describes that. For me, I am nervous yet excited. But yeah, please feel free to use the chat box or unmute yourself and let us know how you're feeling. Let's have a quick check in. Yay. That's great. All right. I will now be sharing my screen. Okay, is my screen visible?
Yes,
Yes,
it
it is.
is.
All right, okay. Um, just a minute. Awesome. Shreya, are we good to begin?
Yep,
Yes, we can
we're
start.
yeah.
Great. Okay. So, like we know, we are here today to learn more about to learn more and understand about the eating disorders. So, without further ado, let's dive into it. Um, So these are some of the topics that we will be covering today. First is eating disorder and its prevalence. Second is the types of eating disorders. Third is signs and symptoms. Fourth is the effects and causes. Fifth is treatment and recommendations. And sixth, we have a short quiz so that we know that you paid attention throughout the webinar. All right, a little disclaimer before we begin. The content on this PPT is meant solely for educational purposes, and it does not mean in any way that we are trying to substitute any advice by a medical or a mental health professional. So, if you suspect or if you feel that you're facing any sort of mental health related problems, please seek professional help. Since I am a mental health advocate and so is Shreya, we are not qualified to provide you with professional help, but we can definitely connect you with a professional. So if at any point of time you feel overwhelmed or you feel like you can't take the information in, or if something is triggering you, please feel free to reach out to us, or you can simply leave this meeting, take a small break, and join in again whenever you feel like. All right? Great. So let's start with talking about what exactly eating disorders are. So eating disorders are severe. Just a minute. Yeah, eating disorders are severe medical conditions, medical disorders that are marked by disturbances in a person's eating behaviors. So an eating disorder is characterized by negative emotions and distress about food, shape, weight, body, and appearance. So, in an eating disorder, a person is intensely preoccupied with their body weight, food, shape, and obsessions with these aspects of the body and food may be signs of an eating disorder. Now, eating disorder is something that is so severe that it can interfere with a person's daily functioning. And like it's mentioned here, eating disorders can affect both physical and mental health of an individual, because it has a huge negative impact on one's social, physical, and mental well-being. And in severe cases, it can also be life-threatening because it can lead to severe medical conditions, which can eventually be fatal.
So when we look at prevalence, we're essentially looking at the proportion of the population that has this disorder. The lifetime prevalence for eating disorders is usually high, and as we discussed in the game a little earlier, it's more common among females than it is in males. Usually, eating disorders develop during adolescence and early adulthood. However, each disorder may have their own age of onset, which we will discuss shortly. More than 70 million people in the world have been affected by eating disorders, and anorexia nervosa has the second highest mortality rate among all mental illnesses, which leads to 70 to 71 deaths per 100,000 in the population by the age of 40 years. We're going to now talk about each of the eating disorders. However, before that, we want to again issue a trigger warning that some of the content that might be presented might be overwhelming for you guys. So in case you want to step out or in case you want to zone out for the next 15 minutes, it would be a good idea. We would also recommend talking to a mental health professional in case you do feel overwhelmed by the content because it may be personal or triggering for you. Can you go to the next slide, please?
Sure.
So when we look at the Diagnostic and Statistical Manual of Mental Disorders, the fifth edition categorizes eating disorders into 6 varieties. We will be going into each of those with Ankita and me going alternatively, and we will give you a brief overview of what each disorder looks like.
All right. So firstly, we look at anorexia nervosa. This eating disorder is most common, and it is also very well known among the population. Like it's mentioned here, it's more prevalent among women as compared to men, and it usually develops around during adolescence. This disorder is commonly found in young adults. People with anorexia nervosa have a distorted view of themselves where they feel that they are overweight even when they may be severely underweight, like it was mentioned in the question, and most of you said that it's true, which it is. So people with anorexia nervosa, they tend to engage in extreme weight loss strategies, such as dieting, using laxatives, diuretics, constantly checking their weight, severely restricting the calorie intake, completely avoiding carbs, fatty foods, and also maybe take excessively exercising as well. Anorexia nervosa has the highest death mortality, and if early diagnosis and help is provided, then better outcomes can be expected. However, in very severe cases, like it's mentioned here, it can eventually result in death. So let's look at some of the symptoms of anorexia nervosa. First is that being extremely underweight or thin. Second, they have an intense fear of gaining weight, and that is why they engage in excessive behaviors to avoid that. And some of the excessive behaviors, like I mentioned earlier, may be intense exercising despite being underweight. They constantly look at themselves in the mirror and they see themselves as overweight, even when they're not. Restrictive eating patterns, they either don't eat anything at all, or even when they do, they have very small amounts of it, which is not sufficient for their body. And lastly, a distorted body image. Their self-esteem is entirely based on how they look and how much they weigh. And that's why their self-esteem and their self-worth is completely based on how they perceive themselves. And they deny the fact that their body weight is extremely low.
Talking about bulimia nervosa usually develops during adolescence or early adulthood, and it is more common among females than males. This disorder has two conditions. So, firstly, there are recurrent episodes of binging, which is consuming large amounts of food and feeling a lack of control over a restricted period of eating. And this after binging, there's an other compensatory strategy or behavior that the individual will engage in, such as purging, use of laxatives, self-induced vomiting, fasting, excessive exercising. All of these in order to compensate or curb the weight gain or any kind of harm that the binging episode would have led to. It's important to note that a diagnosis of bulimia is given only when this behavior of binging and purging has been seen consistently at least once a week over 3 months. Along with these two behaviors, there's also inaccurate self representations and self evaluations based on your body weight and your body type. However, persons with bulimia may or may not be overweight or underweight, they may have a normal weight as well. A few physiological symptoms of bulimia are gastrointestinal problems like acid reflux, worn out tooth enamel, decaying teeth, sensitive teeth, constant exposure to stomach acid due to the binging and purging, swollen salivary glands and chronically inflamed throat, distress and irritation in the intestines from the use of laxatives, and dehydration and an electrolyte imbalance in your body.
Next, we look at binge eating disorder. So, binge eating disorder begins during adolescence and early adulthood, but it can but it can develop later in life as well. Individuals with this disorder lose a sense of control over their eating habits. A major difference between binge eating disorder and bulimia nervosa is that when a person indulges in eating large amounts of food, that is a binge eating episode, they do not follow any purging related compensatory behaviors. So a person with a binge eating disorder typically eats large amounts of food in a very short period of time, and although they feel a lot of guilt and shame after eating so much, they don't seem to stop doing so. They can't avoid this unhealthy eating habit even when they're aware of it. People with this disorder are often obese or overweight, but again, not necessarily. They can also fall in a healthy weight range, but and yet they may have an binge eating disorder. So some of the symptoms of binge eating disorder are: first, eating large amounts of food fast in a short period of time despite not feeling hungry; continuing to eat till one feels uncomfortably full, and yet they can't and yet they don't stop engaging in this in binge eating the next time; eating in secret or alone to avoid any embarrassment because they do feel shame and guilt for this for engaging in this eating I'm so sorry, for engaging in binge eating; and lastly, feelings of distress like shame or guilt when thinking about the binge eating behavior. This is a video that gives you an overview of the three disorders that we have looked at. I will now be playing it. I hope, let me know if you
Eating
can hear
disorders are
it
about more
well.
than food. They're complex mental health conditions that affect a person's sense of worth and self-esteem and can take a serious toll on his or her physical health. Binge eating disorder, or BED, is one that's more common than you might think. In fact, in a survey across 14 countries, almost 2% of people experienced binge eating disorder. And although all eating disorders deserve attention, in this study, binge eating disorder was more prevalent than bulimia in virtually all countries. One thing all eating disorders have in common is that they seriously disrupt eating behavior. Individuals with anorexia nervosa often go to great lengths to maintain a low body weight, often by drastically limiting how much they eat or by exercising to excess. Their perception of themselves is often skewed, so they may feel overweight even when they're not. By comparison, those living with bulimia nervosa often binge or eat large amounts of food, then purge or get rid of that food, often by vomiting or using laxatives. So rather than limiting what food goes into their bodies, they control how food leaves their bodies. Importantly, just because a person may sometimes binge eat, that doesn't mean they have binge eating disorder. So, where exactly does binge eating disorder fit in? You can think of binge eating disorder as a repetitive cycle of eating and distress. While its exact cause is unknown, binge eating disorder may have origins in the nervous system, which is designed to process information and mediate behavior. Possible triggers include social stress, restrictive diets, negative feelings towards food or one's body, and boredom. But what differentiates binge eating disorder from other eating disorders we've already looked at? For starters, with binge eating disorder, no actions are taken to undo or make up for the effects of binging, like vomiting or overexercising, as with bulimia. And interestingly, binge eating disorder affects men and women more equally than bulimia tends to. Now, what exactly counts as an episode of binging? These incidents involve eating very large amounts of food with a sense of lack of control. Much more food than most would eat in a similar time period or situation. And these episodes don't just happen on Thanksgiving or at buffet dinners, they occur on a regular basis. But how often is regular? The episodes must occur at least once a week for 3 months before the behavior can be considered recurring and not just occasional. How can you learn to recognize binge eating disorder? Well, symptoms might include eating extremely fast, eating until you're uncomfortably full, eating without actually being hungry, eating alone due to embarrassment, or feeling depressed afterwards. In fact, feelings of shame, guilt, or disgust after eating are quite common, causing a great amount of distress. And those living with binge eating disorder may hide their behavior due to shame, even from their doctors and loved ones, but they don't have to. Recognizing binge eating disorder is the first step to getting help. If you think you or someone you know might have binge eating disorder, you can always ask a healthcare professional or reach out to patient organizations or support groups. They can lend an ear, help you understand what you're going through, and may be able to help you manage your condition. Learn to recognize binge eating disorder. There is help. To take action today, you can reach out to the following organizations.
All right. We hope you liked this video. And like I said, it pretty much sums up everything that we have seen about the eating disorders. And yeah, it covers a very good point as to how to recognize binge eating disorders. And I would like to repeat that a binge eating episode should occur once a week for at least 3 months to categorize this disorder, to categorize the eating habit as binge eating disorder.
Eating disorders are about more than food.
Sorry.
They're
We'll now talk about the less common eating disorders. There are three more. Pica is one of those disorders. It's most frequently observed in children and persons with mental disabilities like intellectual disabilities or autism spectrum disorder, but it can also occur in adolescents and adults as well. Pica includes eating eating things that are not considered food or they are non-nutritive food. This eating should be over a period of at least 1 month to be considered as a disorder. Example of these substances would be chalk, dirt, soap, hair, paper. It's important to note that consuming these kind of substances should be inappropriate to the developmental level of the individual. So while you may think that for a young child, for an infant, it might be okay to eat soil and soap because they're exploring the world. But if it happens at a higher developmental age, that is when it is a red flag and it needs to be considered further. Individuals having Pica are at a higher risk for nutritional deficiencies. They can get infected. They can have gut infections. They can get poisoned. They can the substance that they eat can also be fatal based on the substance that they have. It's also important that the substance ingested might not be culturally or socially acceptable as a practice in order to consider it as Pica. For example, in a few religions in India, there's when you engage in a religious ritual, sometimes consumption of ash is considered as a part of the ritual. So when that is considered, it will not be a part of diagnosing a person with Pica.
Next, we look at rumination disorder. So this disorder typically develops during infancy, childhood, or adulthood. Think of the cow's curd chewing or rumination process. This is what it's similar to. In rumination disorder, a person regurgitates food they have previously chewed and swallowed, and later they either re-swallow it or spit it out. Adults tend to usually spit the food out, whereas children tend to re-swallow it. So, what exactly is regurgitation? Regurgitation is the action of bringing up the swallowed food again to your mouth. This typically occurs within the first 30 minutes of ingestion. And it is important to know the difference between an acid reflux and regurgitation. An acid reflux is an involuntary action, whereas regurgitation needs to be a voluntary action. uh, this disorder, if not resolved, can lead to severe malnutrition because the body does not get the time to absorb the important nutrients, and it may also eventually cause weight loss with fatal consequences. The cause of this disorder is unknown, and research is still ongoing.
Avoidant restrictive food intake disorder, or most commonly abbreviated as AFID, it develops during infancy or childhood and it can persist through adulthood. And this disorder occurs equally among men and women. A person who has AFID has disturbed eating because they have a lack of interest in eating food. They engage in avoidance based strategies based on the sensory characteristics of food, such as the color, such as the smell, such as the temperature or texture. And this goes beyond the normal behaviors of picky eating or lower food intake. Um, because of such avoidance related strategies for having food, there's a failure to meet appropriate nutritional needs, and this is further associated with significant loss of weight, significant deficiencies in nutrition, and a high dependence on supplements of nutrition. This also interferes with your psychosocial functioning. And another important part of diagnosing AFID is that it does not include food rejection due to religious or cultural practices. So again, an example in India would be certain religions over here do not consume meat as part of their religious belief. So in that situation, you would not consider that as a part of your diagnosis while um, diagnosing with AFID.
Uh, Now we look at some of the initial signs of eating disorders. But before we dive into this, I would like to give a small disclaimer. It is very important to know the difference between disorganized eating and an eating disorder. Disorganized eating is a pattern of atypical eating and food behaviors where an individual might skip their meals, binge eat, or completely where I'm sorry, I'm just flustered a little. Okay, so where an individual might engage in binging, skipping their meals, But the major difference between an eating disorder and disorganized eating is that the eating habits and the behaviors of an individual with an eating disorder is more frequent, more intense, and it has a greater negative impact on their life. So it can be very tricky to actually identify the difference between an eating disorder and disorganized eating, and that's the reason why we should leave it to a trained mental health or a medical professional to diagnose the disorder if there is any. The reason why we're discussing these signs is just for you to have an idea as to what could be some of the warning signs of an eating disorder, but we in no way intend to encourage you to step outside and diagnose people or yourself. So if you feel like there are any warning signs, where any of these signs are present in someone else or in yourself, please seek professional help. So we usually typically look at three types of signs when we are looking at warning signs of eating disorders. The first one is behavioral signs. Some of the behavioral signs that I mentioned here are eating a lot or very less, throwing up, excessively working out, strict eating patterns and obsessive habits like chewing gums, constantly trying new diets, frequently looking in the mirror, and avoiding social situations. One of them could also be constantly checking one's weight. Next, we look at psychological signs, the one that are related to our emotional and mental well-being. First is preoccupation with weight and shape. As mentioned earlier, they are obsessed with their weight, shape, appearance. Second is discomfort around others. They don't feel comfortable when they are with anyone, when they are in public about their appearance. Third, extreme mood swings. Fourth, irritability. Fifth, extreme bodily satisfaction. Sixth, low self-esteem because they because they base their self-worth and self-esteem entirely on how they look and how much they weigh. And lastly, heightened anxiety during meal times because they feel that they have to eat or they don't have to eat something, so they feel pretty anxious during around meal times. And lastly, we look at physical signs because although eating disorders are psychological in nature, they impact our physical condition in drastic manner. Some of which are swelling of cheeks and jaw areas, weight fluctuations, stomach cramps, constipation, acid reflux, etc. Discoloration of teeth due to vomiting, menstrual irregularities, feeling cold all the time because they might be malnutrition, feeling sleeping problems, muscle weakness or cramps, inability to stand for long, dizziness, and fainting.
We'll quickly look at a short video which will kind of encapsulate the effects and consequences of an eating disorder. And then we'll move on to discussing how eating disorders affect our daily lives. So could you just play the video, please, Ankita?
Well, I think we need to understand the really important role that starvation plays. Starvation has a profound effect on personality functioning. And when we look at someone struggling with an eating disorder, a number of the symptoms that we see, such as anxiety, irritability, depression, mood swings, difficulties with sleep, episodes of crying, losing interest in things that they used to enjoy, problems with concentrating in school, becoming more isolated from friends and family, often can be symptoms of starvation directly. Other emotional factors having to do with eating disorders, many people feel terrible about themselves, very, very low self-esteem. And this can lead to thoughts about self-harm or even suicide, as well as thoughts of feeling full, feeling fat, both thoughts around that, feelings having to do with that. Another example of thoughts would be what we call cognitive distortions, such as black and white thinking. An example would be either I get 95% on a test or I'm a failure. Either I'm fat or I'm thin. That would be an example of thinking about things in extreme categories.
So we did get to know a little bit about the emotional effects of an eating disorder. We're going to now discuss how these effects may play out in your daily life. Could you go to the next slide, please?
Yes.
All right, so when we're looking at disordered thoughts, which may lead to compulsions, these are intrusive thoughts about your weight, about your appearance. There's a preoccupation with perfection. Um, there may be a tendency to engage in certain compulsive behaviors, which kind of restricts your functioning. It restricts your, it encourages you to engage in restrictive behaviors. And they also significantly interfere with your relationships and your daily function. Constant degradation of self-esteem. Self-esteem fluctuates primarily on the physical appearance, and feelings of not being good enough constantly emerge, which would hinder social interactions and also work-related commitments. As the video discussed, based on the feelings of anxiety and worthlessness, there may be comorbidities with other disorders like anxiety and depression. In fact, research has suggested that eating disorders have a high comorbidity or co-occurrence with anxiety as well as depression. Negative impact on the lives of people from your inner social circle, your family and your close friends who may see you struggle and may want to help out. It may create a strain in those relationships since they may worry about your health. It may give rise to arguments or other negative interactions as well. As Ankita mentioned, it does impact your physical well-being. There's feelings of weakness, there is excessive sweating, there are physical deteriorations in your health, which do impact physical well-being as well. Lack of treatment. In the quiz that was conducted prior to our presentation, it was mentioned, right? So a lot of times persons with eating disorders do not consider their condition as a disorder, or they may be unwilling to seek any kind of treatment. When either of these conditions happen, there is a breakdown of your personal and professional relationships as well as your functioning for any kind of commitments you may have.
Now we look at some of the risk factors for uh, yeah. Now we look at some of the risk factors for eating disorders. So what exactly are risk factors? Firstly, risk factors are some of the factors that make an individual vulnerable to to a particular disorder, and here in this case, eating disorder. However, it's very important to note that even though these factors are even though an individual is affected by these factors, it does not mean that the individual will have an eating disorder for sure. It just makes them vulnerable to having an eating disorder. So we look at three types of factors that usually influence a person's vulnerability. First is biological factors, which has under which comes hormones, nutritional deficiencies, and genetic. In females, increased estrogen levels leads to increased hunger and appetite. Next, we look at psychological factors. Low self-esteem. So this is actually a vicious cycle. What happens is if a person has low self-esteem, they tend to engage in unhealthy eating habits, which leads to an eating disorder. And because which leads to physical and psychological effects, and that again leads to low self-esteem. So you see how it's like interrelated. Second is perfectionism. Somebody who strives to be perfect when it comes to appearance and weight. Third is childhood obesity, and lastly, it's anxiety, like Shreya had mentioned earlier. Uh, then we look at environmental factors. Under environmental factors, first is family and childhood trauma. There is also a chance of a person developing an eating disorder if they are a survivor of abuse and any form of abuse, in fact, that is physical, psychological, or sexual abuse. Next is career demands for a specific body type. What this means is that, for instance, if a person is an athlete, then they would require to maintain a certain type of weight. certain weight, and that would lead to them being more vulnerable to developing an eating disorder. Aesthetically oriented sports, and lastly, we look at cultural and peer pressure. There is one more important environmental factor that is not mentioned here, but if somebody could think of it, please type it down in the chat box. I would like to know if you know what is missing from this slide, or maybe unmute yourself.
If you guys know
Okay,
the
no
answer,
worries.
please type it
Sorry.
in the chat box. Or you can just direct message me and I can read out your answer if you guys know the answer.
Yeah. Or I'll just help you with the answer. It's social comparison. That's also a very important environmental factor, and is one of the common causes for an eating disorder. Now we look at treatments for eating disorders. Again, these treatments are meant to be given only by a mental health or a medical professional. Um, we won't be diving into what exactly are the treatments and how they are used, because this is just for informational purposes. But if you want to know more about any type of therapy or medications, you can reach out to us later and we will definitely help you with how exactly that treatment is given to an individual with an eating disorder. So first we look at psychotherapeutic treatments. Some of the treatments that come under psychotherapy are CBT, that is cognitive behavioral therapy. Second is exposure therapy. Third is family-based therapy, because your family supporting you in with this treatment, with this eating disorder, plays a very important role when it comes to treatment. And lastly, we have group psychotherapy. Now, who is eligible for providing with psychotherapeutic treatments? Psychologists and psychiatrists who are qualified and who have specialization in treating the eating disorders, only they can provide psychotherapeutic treatments. Next, we look at medications. Medications are most effective when they are given with psychological therapy. Some of the medications that are helpful for treating an eating disorder are antidepressants, and medications are also used to treat the other physical health problems that may be present due to the eating disorder. Now, who can prescribe medications? Either a general practitioner or a psychiatrist. Please note that a psychologist cannot prescribe medications because they do not have a medical a medical degree. Next is medical monitoring, which is very essential when it comes to treating an eating disorder, because one has to constantly monitor the individual's bodily functions, such as blood pressure, blood glucose levels, heart rate, menstrual cycle, and some of the other bodily functions that need to be monitored can also be constantly checking the blood count, etc. And adverse effects of if overlooked may lead to hospitalization, because these physical conditions can, like as mentioned earlier, can have fatal consequences. Who does medical monitoring? A general practitioner helps you with this treatment. Lastly, we look at nutrition education, which again is very important when it comes to an eating disorder. A nutritionist basically helps in developing a tailored plan to ensure efficient diet depending on the severity, intensity, and frequency of the eating disorder in the individual. And some of the goals that are fulfilled by a nutritionist is that they help the individual work towards having a healthy weight. Next, they help in understanding the effects and the importance of nutrition on body. Uh, they also help in meal planning and practicing the habit of healthy eating. Establishing regular eating patterns is also very important, because people with an eating disorder might completely skip their meals or eat too much, as mentioned earlier. Avoiding unhealthy eating habits such as dieting, binging, or skipping meals altogether. And lastly, correcting health problems, which may eventually result in malnutrition or obesity. So this is a very good quote by Demi Lovato. It says that eating disorders disorders are serious mental illnesses and not lifestyle choices. As most of you rightly answered, it is not a personal choice.
So, what can we do? There are a few first steps that anybody who is either suffering from eating disorders can take, or people who are supporting people having eating disorders can take. The first step is you talk about the condition. Talking about what is being experienced, what is being felt is extremely important. It's common that you may talk about feelings of guilt and shame, but seeking support and advocating for yourself and the condition that you're in is the first step towards a long term sustainable recovery plan. Seeking help of a healthcare professional. You'll have a multidisciplinary team, like Ankita mentioned earlier, to help you because eating disorders are primarily psychological in nature, but also have detrimental impacts on your physical health as well. So, seeking support and ensuring that you are talking to different members from the healthcare community is important. Listening to your treatment team. The path to recovery can be difficult, it can be overwhelming. However, when you have the support of your treatment team, adhering to the plan as best as possible, because it's not going to be possible for you to adhere to it 100% in the first time. So, as best as possible is recommended for a healthy future. Being patient is again another step that has to be mentioned because when you're looking at recovering from an eating disorder, you're looking at lifestyle changes that have to be made in order to sustain the recovery. So, recovery will not be a quick process. There may be instances of relapse, and being patient through that and being patient with yourself as well as the team and your social support is extremely important. Believe you are worth recovering. The path to recovery will look different for everybody. There's a saying, right? 2 steps forward and 1 step back is still a step forward. So believe in yourself and your worth. And it might be difficult because there are self-esteem issues that do come up with eating disorders. But that is where caregivers, family members, etc., come into play, and they provide a sense of constant support. They provide a safe space to listen, and they encourage the person suffering from an eating disorder to work on their recovery sustainably.
So we have actually found this short video on eating disorder. However, we will refrain from playing this here because it can be a little triggering for some people. But we will definitely be sharing the link in the chat box after this presentation. And those who feel comfortable and those who feel that they want to watch this video, they can do so on their own. But please remember that it's okay if you can't watch it or if you don't want to watch it. It's completely okay. But yeah, and while you're watching it, please take care of yourself. So, ending on this beautiful note, this beautiful quote: "Look down at your body, whisper, there is no home like you." So, we've come to the end of our PPT, and we have. And like I said, there's going to be a short quiz so that we know that you paid attention throughout the webinar. So please feel free to use the chat box or unmute yourself to answer these questions. So the first one is, can you state 1 or 2 ways in which eating disorders affect our daily lives?
Please feel free to unmute yourselves or type your answers in the chat box. And if you're shy, you can PM the answer to me and I'll read your answers out too.
Yes, we have one response. It may cause anxiety and depression.
Right, that's correct. Any more responses? I can't see the chat box. I'm sorry.
It's okay, I'll monitor the chat box.
Should I move on to the next question?
It can affect our emotional and physical well-being is another response. Yes, absolutely right. I think we can move to the next question. I'm not seeing
All
any
right.
more responses.
Okay. Name one psychotherapeutic treatment that can be given to people with eating disorders.
Cognitive behavioral, yes.
Can they also tell us by whom is a psychotherapeutic treatment given?
Family-based therapy,
Family-based.
yes. CBT, psychiatrist, yes. Psychiatrist or qualified psychologist, psychologist. Yes. Medications is another branch of treatment given for eating disorders. So there's psychotherapeutic treatment, and in addition to that, there's medication.
Group psychotherapy, correct.
Should we move to the next question?
Yes.
Can psychologists
psychologists
prescribe medications?
Shreya, would
Do
you
you
like
want
to take that?
Sure. So psychologists cannot prescribe medications. There is a requirement to have a medical degree, that is a psychiatrist who is qualified to prescribe medication. Clinical psychologists tend to have knowledge about the medications and they work with psychiatrists together in order to create a treatment plan, but psychologists inherently cannot prescribe medication.
Right. And to add on to what Shreya said, clinical psychologists, they diagnose the mental health problems, but they do not prescribe medications like she rightly said. We hope that answered your question, Netra. No worries. Moving on to the next question. Can you name the disorder wherein no actions are taken to make up for the actions of binging?
Binge eating disorder, yes.
That's correct. And which is the disorder in which actions are taken for compensating for the binge eating? Any idea?
Bulimia.
Correct.
Yes.
Moving on to the next one. Yes, that's right. What are the three types of warning signs that we looked at? Warning signs were the one that were the initial signs that can be identified for an eating disorder.
If you know one, you can put one in the chat.
Strict eating patterns. Yes. Antisocial behaviors. So yes, so these are the types of, so these are some of the examples of, like, these are some of the signs under the types of warning signs. What essentially low self-esteem, yes. So sleep problems, correct. So essentially the answer for this is the three types of warning signs that we looked at were behavioral, psychological, and physical, and yes, emotional. And sleep problems come under physical, low self-esteem comes under psychological, antisocial behaviors under behavioral, and strict eating patterns again under behavioral. Does that make sense? All right. Is eating disorder a personal choice?
You got an instant answer of no. Thank you.
That's a good sign.
Yes.
Great. Thank you. And lastly, what is the key difference between bulimia nervosa and anorexia nervosa? You can also unmute yourself and talk if it's too much to type.
Absolutely right.
That's
Perfectly
on
worded.
point.
Yeah. Right. So people with bulimia purge while those with anorexia don't. Yes, but people with bulimia also intake a lot of food, while persons with anorexia may restrict their intake altogether.
And people with
Anorexia.
anorexia might also purge, but yeah, it depends. Like the food intake and the way they control the intake of the food is where the difference lies mainly. And anorexia, yes, they are scared of being fat, right? All right, so this brings us to an end of our PPT and our quiz. Now we are open to questions, and yeah, we'll try our best to answer them. If you have any questions, please feel free to unmute yourself or drop your questions in the chat box.
Some people actually like PM'd me the question, and
Okay.
a person asked me, are there any personality traits that are more common in individuals with eating disorders? And do people get comorbid disorders like with personality disorders as well as eating disorders?
Okay, so basically, when we look at when we look at an eating disorder or for any mental health disorder, for instance, we don't focus on personality traits, but we focus on their behaviors. So, I mean, although, for instance, there is a myth that says that people who are people with a mental illness are shy or quiet, but that's not true because a person even without a mental illness may be shy or quiet because because shyness is a personality trait, and that's why we cannot use that personality trait to diagnose someone with a mental health disorder. And we essentially look at their behavioral and their psychological patterns when it comes to a mental health disorder. Does that answer the question?
Yes, definitely. And someone asked, are there any long-term effects of eating disorders, like after the person has recovered for, let's say, anorexia nervosa? Are there any like lingering effects still stick with the person?
Sure. Shreya,
So,
would you like to take this up?
sure. Yeah. So there may be lingering long-term physical health effects, and you might have to closely monitor the self-esteem levels of the individual for a chance of relapse. But in case they're adhering to the treatment plan, then over the period of time, the physical health effects can be worked upon. And with respect to the esteem also, if we are working on it while taking psychotherapy, then those are also situations that can be worked upon. So there may be immediate lingering effects, but those are things that over the period of time that can be worked upon, again, depending on the severity of the harm that has been caused due to the eating disorder.
Another person asked, like, it said that there are many types of therapies and treatment options, and are there any specific like treatments that are better for, per se, like anorexia, and some are better for binge eating disorders? And are there like different types of treatments for different disorders?
Right. What happens is when we look at an individual with an eating disorder, it's very important to gauge the severity, the frequency, and the effects of the eating disorder. And only then the professional can move on to a treatment plan. So there has been a study where depressants, the medications that we talked about, they work better for bulimia nervosa and binge eating disorder. However, again, it totally depends on what the condition of the individual is, what type of eating disorder they have, and again, the severity and the frequency of it. So that's the reason why it's very important to first get in touch with a professional, and so that they can guide them accordingly.
Just to add on to that, so cognitive behavioral therapy, since eating disorders are specific with preoccupations of having thought distortions related to your appearance and things like that, cognitive behavioral therapy has proven to be empirically the most effective with eating disorders. In addition, you can also go for group therapy depending on the kind of um, representation of symptoms that do come up. So support groups are very common for persons with eating disorders because they need to know that they're not alone in this, and that itself may be helpful for treatment. Again, it really depends on the way the symptoms are manifested in the person, and that's when a viable treatment option has been is chosen.
Okay, someone typed in a chat box saying, does hypnosis work for like the treatment of eating disorders as well?
So
Okay, so yeah, sure, please, Shreya,
no,
go
no,
ahead.
go ahead, go ahead.
Please.
Okay, so mine is a very tentative answer. I've heard that hypnosis works, but I do not have any firsthand research evidence to go by it. So if you do, Ankita, then you could probably take this on better.
Yeah, I mean, so like Shreya said, there hasn't really been much research when it comes to hypnosis and eating disorders. And also, the treatments that we have mentioned here, they're just limited. I mean, there are a lot more treatments out there for eating disorder. And yeah, it all depends on the type of eating disorder again and the way the symptoms have manifested themselves in an individual. So we don't really know if it would work. Again, it all depends on the treatment plan that is suggested by the professional. And I believe there was a follow-up question, Natalie, when you about the comorbidities. I don't think that I quite answered that. So yeah, that is actually a very good question. There is a high possibility of there being of an individual having a comorbidity, and the comorbidity can be again physical or psychological. That is, an individual with an eating disorder have a high chance of being prone to having depression and anxiety and other types of mental health related problems. But they also are comorbid. They may have a comorbidity in physical with a physical condition as well, so such as diabetes or blood pressure issues, because again, since it's an eating disorder, it deteriorates your physical health as well. Netra has a question.
Yeah. I think we can ask like three more questions, and then we can like, if there are any more questions, they can just email you guys or us.
Definitely, yeah.
Sure.
Okay, so regarding Netra's question, she asked, in terms of treatment, other than the prescription of medications, are there a difference between psychiatrist or clinical psychologist?
Share, this one's yours.
Okay. So psychiatrists essentially have a medical background. They go into the science in India, it's art, science, and commerce. So they go through the science field and they get into the MBBS degree, after which they do their MD. So they have a doctor name in front of them. Clinical psychologists or other psychologists in general go through the arts field usually, and they have a master's degree or they have an MPhil degree with them. So essentially, it's two different fields that are working. So psychiatrists usually focus more on the biological aspects of the disorder, while psychologists look more towards the psychological, emotional, social impacts of the disorder. But it's always preferred that both of them work together to create a holistic treatment plan.
We hope that answers your question, Netra. Um, Lastly, will eating disorder brought by study stress? I don't think I quite got that, Shreya.
Do you mean that stress related to academics can be a reason for causing eating disorder? Is that the meaning of your question?
I think she means that, well, is study stress a cause of eating disorder or like contributes to the development of an eating disorder? think that's her
Right.
question.
Yeah, actually,
Should,
that's true. High expectations can lead, make an individual vulnerable to eating disorders. High expectations could be from academics or even from their own parents or the caretakers or their siblings, anyone at home. So yeah, it can.
and prolonged stress can definitely be an important factor playing in eating disorders as well.
We hope that
Okay,
answers
one
your
last.
question, Felicity.
Oh yeah. There's one last question. Is a person asked me if they want to seek help because they suspect that they have an eating disorder, but when they tell their parents, their parents don't understand it. So what can they do in that case?
Share, please.
Firstly, I'd just like to acknowledge so thank you for, bringing up that question. It is the first sign of seeking treatment, that awareness that you've shown. And it takes a lot of strength to be able to acknowledge that for yourself. So kudos to you for that. Secondly, there are several helpline numbers right now that exist for mental health. The starting point could be beginning a conversation with a counselor over a helpline, which you could do on your own. And then once you discuss how severe the disorder is, the counselor could, lay out further steps for you to go ahead with the treatment. And then again, family-based therapy is an option. Once you start individual work, then you can always include your family to seek support from them.
And
I hope
also,
that answers your question.
yeah, just to add on to it, also if your parents are not understanding or if they're not ready to believe you, you can take help from maybe your friend or your sibling or anybody else who can be your social support, and then you can move ahead with the treatment. And yeah, thank you so much for bringing this up.
Yeah, I think that's all the questions. So, is there anything you guys want to add, or is that it?
Well, we have pretty much covered everything from our end, and we hope that this was helpful. And like we said, again, we would like to, emphasize on this fact that this was solely for informational purposes, and we hope that you are doing okay after this presentation. And yeah, please reach out if you feel overwhelmed, and if you have any other questions, please feel free to reach out to us. We will be sharing our email address here, and you can definitely get in touch via email. And we would just like to give a shout out to the to people who have helped us make this PPT. Tuba, Shreya, and Shreya wouldn't have been possible without them. So yeah, that's about it. We don't really have anything else.
Ankita, do you think we could do a quick check-in with them, like the way we did at the beginning of the presentation? We could just see
Oh
how
yeah,
everybody's doing. Maybe you
definitely.
could put one word in the chat to let us know how you're feeling, how the presentation was for you, anything that's coming up.
Yeah, feedback is appreciated. It would be great. I, for one, feel relieved now.
Count me in that too.
Yes, thank you, Shreya and Kita, for such a wonderful presentation. And I am pretty sure our audience have learned a lot more on eating disorders. So yeah, this is basically the end of our webinar, and we hope you all enjoyed it. And if you have any more questions, feel free to contact Minds Foundation or the Global Mental Health Outreach Program. We are always here to support you and help you, so please don't hesitate to reach out if you need any help. Once again, thank you so much for attending our webinar, and we hope you have a nice day. Thank you.
Thank
Thank you
you.
so much for having us once again. This was great. And yeah, I have dropped in my email ID in the chat box. Please feel free to save it and reach out to me at any point of time. And yeah, please take good care of yourselves, stay safe, eat well, and take care. Bye bye.
Bye-bye. Have a lovely day ahead.
Goodbye. Thank you
Yes.
so much.
Thank you.